Our interventions right now are largely targeted for patients with treatment-resistant depression, so people who have struggled with major depressive disorder and have failed at least 2 antidepressants. So there's a huge impact and burden of treatment-resistant depression on the population. And these folks really have oftentimes been engaging with psychiatric care for many years. They've cycled through many different antidepressants, psychotherapy, and other treatments, and continue to struggle with depressive illness.
I have tried medication for probably over 20 years, probably like almost 25 years on and off. Either no result or not great side effects. My heart hurt, my feeling, I felt like a darkness inside of me.
I was trying a lot of different things and nothing was really sticking. And I felt like it wasn't really working out for me, and I started just feeling hopeless again.
The drugs, it just stopped working. I don't think it ever really, and obviously it never completely got rid of the depression.
Depression is sort of the thief of joy, right? It steals from you not only your ability to appreciate and enjoy any given moment, but also your ability to believe you could ever experience joy in the future.
I think that one of the really innovative and important things we're doing here at Mindful Health Solutions is trying to integrate novel therapeutics into the general psychiatry setting. So as opposed to having a siloed out ketamine clinic that you might send a patient to, or a TMS clinic, or eventually a psychedelic clinic, or a general psychiatry E&M based clinic, bringing all of that under one roof, training all of the doctors in the clinic to be experts really in all of these modalities to be able to deliver them. And what that allows you to do is to bring a patient in the clinic with major depressive disorder or other psychiatric illness and move them in a rational way through a treatment care pathway to maximize their chance for remission. I think that our organization is really at the front of raising the standard of care in the field of psychiatry by maximizing the outcomes for our patients.
At Mindful Health Solutions, one of our models is putting the patient first. It's all about the patient experience and being able to create an environment for them where they feel that they can actually get hope.
The people here are just really great to work with, and it seems like they really do care about making sure that you're getting the most out of the therapy.
It's a very welcoming place. It's a very non-judgmental place. It is a place where I found every staff member to really be interested in me as a person and want to engage with me as a human being.
The difference here is that I feel like it's a team thing. I'm not being told to feel a certain way. I'm validated, but I'm happy to come here.
If you can share with patients that there are these other alternatives to the more traditional treatments of depression or other psychiatric illnesses, I think that's very, very powerful.
The provider that I was working with here at Mindful Health Solutions, we discussed doing TMS.
Transcranial magnetic stimulation, or TMS, was FDA approved in 2008. And that really opened up the field of interventional psychiatry into an outpatient setting. Because you can deliver non-invasive brain stimulation with TMS in an outpatient setting without any recovery time, anesthesia, and incredibly safely. Someone who responds well to an antidepressant or to cognitive behavioral therapy or to many other treatments who also see this awakening of the frontal lobe. All we're doing with TMS is getting to that same endpoint, just more directly through direct stimulation.
If I was watching black and white TV before, I'm now sort of watching color television. It is a significant change.
We also have good data now that patients with obsessive compulsive disorder, OCD, that have not responded to medications can do quite well with TMS targeted to a different part of the brain.
As someone who's been treating people with OCD for over 2 decades, I can tell you that meds and therapy are great, but they only help a portion of people and they only do so much for most of them. It's been a very frustrating condition to treat up until now. So TMS is exciting because 58% of people actually respond to TMS. And that's regardless of whether they respond to medication before or therapy before, and that's fantastic. And then you've got 32% that actually have remission, which is incredible. I mean, to have the condition go down in terms of symptom burden so much that you can barely make the diagnosis, that's just phenomenal for patients.
Seeing how useful ketamine infusion therapy is and other ketamine therapies are, if provided in a safe way, it's been a game changer. It really has. One of the most impactful things to happen to the psychiatric field for quite some time. Knowing that when people come to me, they come in a place of vulnerability. They're very raw, they're hurting, they have no hope, right? And I think, having gone through challenging things, it's one of the worst is to know, like, I don't have any hope, I don't know how to get out of it. And they come to us with that sort of mindset.
I was really adamant about how I just absolutely had no future at all. And when I did start doing esketamine, I think it really helped me push forward with the idea that I deserve to actually be happy.
Because esketamine helped me take care of the depression, I have a better sense of myself.
For me, it's been incredibly like a big warm hug to myself.
I really feel that this is a miracle to me. A miracle to me in my life that something is working.
When we're able to work with them, tailor a treatment plan, and try a modality that we think is going to be really useful, and to watch that gradual transformation, it's an amazing thing.
I would say the worst thing to do is to suffer in silence, to think you're alone in this, to think that you're the only one who's suffered like this, because it's not true. We'll be there to guide you and refine that treatment and make it the best possible. If it doesn't work, we're gonna listen to you and we're gonna pivot. And we'll try again to figure out what works best for you to get you to where you wanna be.
What's really powerful about our care platform is that how things have been for patients struggling with mental illness in this country is that they really have to be able to navigate a very complicated and confusing network of different kinds of clinics doing different kinds of things. And for someone struggling particularly with mental illness, this can be a really overwhelming task. For us to bring all the major therapeutic modalities under one roof and have our clinicians cross-trained and expert in all of them really takes a lot of the pressure and stress off of a patient. All you really need to do is show up.